So the nice thing about having a new program is that we can build it from the ground up with the first class. We can build it to the specifications of the applicant and the fellow. For example, we're going to have a breadth of experience in our ICU, which is multidisciplinary in nature nowadays from a neurocritical care standpoint, cardiothoracic critical care, surgical critical care, and we have a trauma program. So each, everything is subdivided now, and we have the capacity to allow the fellow to pick and choose what they may be interested in for a career. So that's one of the big advantages of having a large multidisciplinary ICU, which complements our pulmonary division extremely well. We have a 16-doctor faculty, which has grown over the years from 6. And we are going to have 2 fellows per year, and that's going to allow for opportunities of mentorship that are really unprecedented. We're going to allow for the fellow to have both a pulmonary and a critical care mentor, and then as well as somebody who just guides them through the 3 years, helps them with the job application process, etc. So it's going to be a personal experience for the fellow, because whereas we're a very big place, it's going to be a very small, somewhat intimate fellowship training. We have a state-of-the-art shock team, which includes cardiology, cardiac surgery, intensive care, which is activated when patients come in different types of shock. We have capabilities for ECMO, which is a different type of life support that we can use to help prolong or bridge certain patient populations' lives. We have a state-of-the-art operating room. We have a state-of-the-art bronchoscopy suite, which is in progress. That's going to have all of the newest and latest equipment, which we currently have in the operating room, but we'll be moving into our own bronchoscopy suite within the next calendar year. So yeah, we will have the state-of-the-art, not just in equipment, infrastructure, but in training in general. The culture at Vassar Brothers Medical Center right now, I would have to say, has evolved over the years into one of inclusivity, diversity, and the manner in which they've embraced our internal medicine, general surgery, family practice, neurology residents, to name a few, has been overwhelmingly positive. And that's given us the impetus to move forward with this fellowship, because it takes a lot of effort from a lot of different individuals, from a lot of different subspecialties to make something like this work. And I can tell you that this place has embraced academics. I knew it was going to be positive, but I didn't think it was going to be quite this good. There will be multiple opportunities for the fellow to be involved in research regarding clinical outcomes, regarding quality improvement, and they will have responsibilities on different committees dealing with quality metrics for both pulmonary and critical care, as well as the outpatient side of things in the office. Wellness has been key. The residents learn from day one that they have to take care of themselves first, otherwise they're not going to be worth anything to anybody. And there's been no better example of this than the pandemic that we're really still in the midst of, but I think on the back end of, we've learned a lot from a wellness standpoint from the pandemic, and that's going to help us in the future, I think. Well, it's nestled in the Hudson Valley, which has its own benefits as far as outdoors activity, the Hudson River. And on top of that, we're a little over an hour train ride from New York City, a little over an hour drive to Albany, 3-hour drive to Boston. It's situated actually very nicely, not only for living circumstances, but also to share our experiences with different training programs. We have a new 30-bed ICU. That we hope to showcase, and critical care over the years of my years as an attending has become subspecialized in and of itself. As I mentioned earlier, we now have neurocritical care, cardiothoracic, surgical critical care, non-surgical cardiac critical care, trauma critical care, and then basic medical critical care. And so with the evolution of critical care as a subspecialty in general, comes different types of teams like the pulmonary embolism response team, the shock team. And these are collaborative, multidisciplinary approaches to very real problems that we face sometimes daily, at least weekly here at Vassar, where different teams come together as one and take care of the patient, oftentimes with good outcomes. And so we're very proud of that, and our critical care division is going to be one that allows for the fellow to look at each different subspecialty and choose general critical care or one of the subspecialties that they may choose within its scope. At the end of your fellowship here, our goal, if we've done our job, is to allow you to go into private practice and be very successful and a leader in your community, or go into a hospital-based academic practice where you can teach, produce research, and spend more time with academics. We want to prepare you for either one of those tracks. On top of that, we want to prepare you for a niche practice if you like pulmonary vascular disease, if you like interstitial lung disease, if you like sarcoidosis, and you want to look for something that focuses just on that. We want to allow for those opportunities as well. And that's one of the benefits of having so many different big, well-established training programs that we are friends and colleagues with in the greater New York area.